what was some of the effects of this novel gene technology? What was some of the effects on children?
Well, I, from the beginning, was very concerned because essentially what was happening is that these injections were telling the body to make spike protein, which is the very thing that was causing a lot of mischief in the first place. And there wasn't an off switch. So I thought of it, being a pediatrician, as a Goldilocks issue. You know, you didn't want it to be too hot, meaning too many side effects. You didn't want it to be too cold, meaning not enough antibody to really protect you. These injections never were demonstrated, nor never were they studied to prevent transmission. And that's why when our president or other public health officials said, if you take this, the virus stops with you, you won't pass it on, that was patently untrue. It was never studied in the original trials. Some of the worst side effects I write about in the book that is coming out in May about the effects of COVID injections and lockdowns on children. And one is myocarditis. As early as June of 2021, so probably less than about 6 months after the injections came out, we knew that myocarditis in kids, usually boys, was about 12-fold higher in the kids who got these mRNA injections. And yet there was this hope that it was going to be a kinder, gentler kind of myocarditis. And people were still operating out of fear at that point, and I would say a bit of denial. And they still recommended that children get it. And the thing that really surprised me is that at the meeting of the American Committee of Immunization Practices in June of 2021, even if you'd had a myocarditis with your first shot, they didn't say don't get another shot the way that we would if somebody had a bad allergic reaction to penicillin. We'd say, well, don't take penicillin again. But instead, they said you should discuss it with your doctor. And I thought that was pretty wishy-washy. Another thing that happened is significant neurologic damage. In fact, in one of the pediatric trials that only had a little over 1,000 children and adolescents in it, one of the girls actually developed a paralysis within about 24 hours of her injection. When she went to the emergency room, they didn't really know what to do with her, and she went on to develop gastroparesis, which is sort of a paralyzation of the stomach that meant that she couldn't really digest her food and pass it on to the intestine. She ended up with a feeding tube. So the thing that really bothers me a great deal is that when her side effect was reported by Pfizer to the FDA, they classified her as having functional abdominal pain. And the clinicians in the audience will realize that that means abdominal issues where you don't really know what the cause is, and you're sort of implying that it might be psychiatric. There's a girl in a wheelchair with a feeding tube. Now, I want to ask the people in your audience, if you knew at the time that these vaccines were recommended for children that there was a 1 in 1,000 or so chance, at least as suggested from the initial trials, that your child would be paralyzed and not able to eat, is that a good enough odds for you to take this untested, unproven product? I really think it was very fraudulent, is what I'm going to say, to not report it more honestly. We're also very concerned about reproductive side effects. We know that women's menses were very dysregulated, very disruptive. There are many menopausal women who reported they were having bleeding again after not having had a period for 8 or 10 years. There were women that reported that their cycle, which was usually 5 days long and a reasonable amount, was all of a sudden 8 or 10 days old and much heavier, or that instead of having their cycle every month, they were having it every 2 weeks. You know, all these things are clearly interfering with very fundamental, exquisitely controlled endocrinology, neurology, immunology, you know, all those mechanisms that have been honed over millennia are being disrupted by this new technology. autoimmunity is a big concern. One of my former colleagues, Ari Vajani is his name. He's a wonderful immunologist. We published a couple papers together. Early on in the pandemic, he found that about 26 or 27 human proteins have very analogous structures to the spike protein, such that his worry was that as our bodies tried to fight the spike, that they would actually end up destroying certain aspects of human tissue. And unfortunately, he's turned out to be right. Autoimmune diseases did rise. The last thing that really concerns me is the issue of cancer, because we know that these injections disabled something called P53, which you can think of as the guardian of your genome. It's one of the things that protects you against cancer. Now, many of your listeners may be surprised to hear that we all have some cancer cells that we make every day, and we want to have a good immune system to surveil for those cancer cells and essentially gobble them up so that they don't continue to grow. But if we interfere with P53, we are interfering with that very important protective process. And many clinicians in the trenches reported seeing so-called turbo cancers fairly early on in the pandemic, where either the cancer presented at a much younger age than typical, or people didn't present till they were at stage 4, or once they did present, they just progressed more rapidly than typical. And those are 5 of the things that I talk about in my book that makes me very concerned about this generation of children. We also saw higher mortality from other causes and higher disability. And so I think that history is going to prove that these vaccines did more harm than good, and that the evidence that's been used to talk about how many deaths they prevented was more based on modeling rather than actual data, and that the data that came out of the adverse events was based on people dying or getting sick. And I hope I live long enough to see that really come out, because people in some ways seem to have moved on from it. And that worries me, because I think it's going to happen again. And I want parents to really understand how they were manipulated in a number of different ways in the service of this new technology.